Hi, I'm Dr. George Kosmides, and I'm here to answer a question about coffee. A patient asks, is coffee good or bad, and should I stop drinking it? That's an excellent question. What do we know about coffee? Coffee is an acidic beverage, but it's also a stimulant. It also is a stimulant based on what's called an alkaloid, which appears to be difficult on the liver, difficult on the digestive tract, as well as stimulating the central nervous system, so increasing heart rate. So we kind of knew most of those things already with regard to coffee, espresso, that category of alkaloid stimulants. A few things you want to keep in mind if we keep drinking it. And what I recommend is if you're on 3 or 4 cups a day on a regular basis, do not quit cold turkey. You'll get massive headaches, usually caused by adrenal fatigue in most cases, lightheadedness, some dizziness. So again, if your goal is, after your understanding of coffee, is I need to reduce it slowly. I would say 20 to 30% per week, and the goal is to get off it within 6 to 8 weeks. That's fine. Now, if you intend to drink it, there are a few rules. Again, first drink in the morning isn't best for coffee, and here's why. When we wake up in the morning, we're dehydrated. The word breakfast is actually break your fast. So you want to have water, a green drink, something to hydrate yourself. And then maybe the coffee 30, 40 minutes later as you're out the door going to work or what have you. Now, coffee, since it's a stimulant, is a smooth muscle contractor. So what we'll do is we'll contract the smooth muscle, stomach, the intestines, and so forth. What research is telling us that coffee actually interferes with protein absorption. So the worst time to be drinking coffee is immediately after or with your meals. You want to separate it. So again, I don't make the rules, unfortunately. We just have to go by what research is telling us transpires with certain elements. Coffee is the topic of today. Well, what do? I want a stimulant drink, and well, there are some options for you. There's a tea called yerba mate, which is an Ecuadorian, I believe it's Ecuadorian origin, a tea leaf. It has a non-alkaloid-based stimulant factor, which is similar to coffee as far as milligrams per cup. I think it's between 80 and 100 milligrams per cup. I think coffee is slightly greater, maybe 90 to 110. Secondly, it doesn't appear to cause smooth muscle contraction. So technically you could have it with a meal. That's what we have at the office. That's what I have at home. I found it to be quite helpful. There's another tea, and I have not been able to find it for you folks on the East Coast or in European countries. You may. It's called Mormon's tea, and it's a non-alkaloid based tea. Mormon, like the religion Mormonism or Mormon's tea. So again, replacements for coffee can be yerba mate or Mormon's tea. And again, if you're going to cut back on coffee, do it slowly over time, but be consistent with it, and you should do quite well. That's an excellent question. I hope that answered your question, and I look forward to you asking me more. Please like the YouTube channel so you'll get updates from me. And I'm Dr. George Kosmides. Thank you very much for the question.